This is an update on our film, Going Blind, Coming Out of the Dark about Vision Loss.
Yeah, so I don't see your right hand, really. I don't see your left arm at all.
I don't want to be identified as a blind person. And I can't see the crosswalk.
I knew I could literally give up on things for a while, but that's not me.
You learn how to use what you have.
I had been losing my vision to glaucoma for years and needed to learn how I could adapt as my vision worsened. Can I pet your dog?
Actually, no, he's working right now.
The friends I made while making the film helped me to face my sight loss journey with much more knowledge and confidence than I ever could have imagined. Here's what some of them had to say.
It's amazing how little I rely on my eyes. I rely on them for orientation, but not for specificity. So I know where the paper clips are. So as long as I open up the shelf and I go reach there, I'm not actually looking at the same time I'm going to get it. I know they're there.
And I ended up enrolling in a rehabilitation program. And I saw other people, some who were my instructors, who were totally blind, who were giving me instruction on how to be independent and how to survive. That was very empowering. Like, wow, I can overcome this.
I can't spend all day, what if? You got to worry about what is.
You learn how to use what you have.
Going Blind has been shown over 1,000 times on public television stations. We've presented it at international ophthalmology conferences, where I give dedicated research scientists and clinicians the patient perspective on eye disease. This video that we produced for my panel at the Asia Pacific Glaucoma Congress in Busan, Korea, is an example of what I speak on. I've been invited to give you a patient's perspective on scotoma, how little we know about it, how it affects us, and I want you to appreciate how you can greatly improve your patient's quality of life by informing them of where their scotoma is, what area it covers, and what they need to know to deal with holes in their vision. You probably are so heavily scheduled that you think you don't have the time to have these conversations with your patients. You also may not feel comfortable talking to them about their vision loss. So I want to encourage you to refer your patients to trained vision rehab specialists and low vision therapists who do have the time and the training to help your patients. Part of our outreach, which we call Going Blind and Going Forward, entails my bringing Going Blind to young ophthalmology residents so that they can have an idea of what their patients are going through. I try to get residents to talk about their own fears about blindness and their misconceptions.
As a medical student, we focus more on the pathology of the disease. There's so much in ophthalmology, just grasping those concepts and that knowledge is difficult enough, and that's what we focus on. However, I realized when I started working in an ophthalmology clinic and coming to the Lighthouse that there's so much more to the patient beyond what we know we see as cases, whether when we're studying or when we're talking about it with our faculty members. The quality of life and how it affects them is truly something that we need to take into consideration, and that's something we're not as emphasized in medical school.
Before I got here, I thought that it was only patients with advanced disease who were sent off here as kind of a last resort. We have nowhere else to send them, no other medicines to give them, but in fact it's not like that at all.
Over the years, viewers have asked, how's Joe doing? What's happened to his vision? So here goes. When I premiered Going Blind at the World Ophthalmology Congress in Berlin, I heard about a neurostimulation technique being studied, which they thought could stimulate dying neurons. I figured it was worth a chance. 5 months later, I went back to Germany for my first treatment. After my vision was evaluated for baseline, the treatment entailed alternating current administered directly to the eye. This is the concept. The optic nerve brings the data the eye senses to the brain, and the brain interprets that data as sight. But an optic nerve damaged by glaucoma brings less data back to the brain. With electric brain stimulation, The hope is to improve the brain's ability to interpret the data coming in through the damaged optic nerve. I was hoping to be able to read more clearly with my left eye. After 2 weeks of treatment, more evaluations, and then we found out the results.
Die Mutter der Marmelade ist die Quitte. Sie gab dem Brotaufstrich ihren Namen Portugiesisch Marmelo Quitte. What does that mean?
It means you can read.
The treatment seemed to keep my visual field from deteriorating. What a relief. But another challenge in glaucoma is the loss of contrast. It can make reading very difficult. And other problems do occur. At one point, corneal edema lessened the vision in my left eye considerably. It was like looking underwater. And then, 2 years ago, a terrible infection took the vision in my left eye. Even after the infection cleared, my eye was still incredibly painful, and that pain, plus the lack of depth perception from having only one working eye, was disorienting. To get me back on balance, I started using a cane. That helped me to judge distances better and to know where I was in space. But the pain remained unrelieved for months. Standard pain drugs didn't touch it. Then a doctor prescribed CBD tablets, a marijuana derivative now legal in New York State. Within just 3 days, I was feeling normal again. And a week later, I grabbed my cane and joined friends for a trip of a lifetime, one that I thought I'd be in too much pain to go on and would never have the opportunity to see. After a few months, my left eye started to shrink and discolor. Not a great look, and one that made me feel even more feeble than I already felt from the loss of vision. To help my eye maintain its form and to help my confidence, my doctor recommended a prosthesis called a scleral shield. Emery Benedict is an oculist who made my prosthesis. First he made a mold to fit my eye, and then worked with it to make sure it moved properly. Then Emery's artistry came in. He started to paint the mold to match my eye.
And really, we're going to really begin with just getting some background paints on there. I had lost my right eye to cancer when I was 2.5. I don't recall the surgery or whatever went on at that point, but I grew up that way. So I wore a prosthetic eye, my right eye, for my whole life, and that's what got me interested in doing this. But my experience of living life with one eye is a little bit different. I mean, I don't remember seeing with 2 eyes. Everything I learned how to do was with one eye, driving, sports, everything. So I don't know any. I'd love to know what it's like to see with 2 eyes. It must be good. So that's what got me interested in this. I can't say I know exactly what the person's going through because everybody's different, but at least I have some idea. And I definitely have an idea about how they want to kind of look. So people always call your eye color brown. What do you call your eye color?
Brown.
Straight up brown. You have a couple of flecks of different paints in there.
What colors?
I'm gonna put a little gold background in just a couple areas there.
Mm-hmm. My brother had yellowy eyes.
Yeah, you have a little bit in there. I mean, obviously there are so many different shades of brown. I like that, Joe.
Yeah.
Yeah. It's kind of good.
That's good. I'm glad you're happy. That's a start. We'll see how happy I am.
Exactly. Start simulating the blood vessels. This is a shade that I usually use. I think it's the right kind of shade. In addition to threads, I also use red pencil sometimes to pencil in some of the vascularization, depending on what I see in a person's eye. what I feel like it will make it look most realistic. So I got my magnifying loupe on, and I'm looking for scratches and areas that need to be more polished. I want to make sure that it's going to be real comfortable for you, Joe.
Now how to put it in.
So lift up your lid a little bit like this. Put it directly under like that. And then we do something like this. Pretty good movement.
I feel that there's something there. It doesn't feel irritating.
Okay, good. Yeah, don't be afraid. Keep pushing under. Or don't stop. There you go. Now push it all the way under. Very good. And keep on and then just pull a lower lid over it. But don't forget to keep pushing up. Don't forget to keep pushing up.
There.
Yeah, you did it. Not too bad.
Thank you, Emery. This is great.
My pleasure.
Yeah,
Great.
it's hard to believe.
So where am I now with my vision, with my quality of life? I am able to ride my bike, but the anxiety it now causes me takes the pleasure out of it. My depth perception has improved so much that I tend to use my cane only in crowds or at night. It reassures my sense of balance. A cataract has made my vision much blurrier. I will have it replaced, but with only one working eye, I'm not in a hurry to risk another infection. The cataract, the loss of contrast, has made computer reading difficult, but the ability to experiment with settings and font sizes makes work a lot easier. Should my sight worsen, I would certainly want to add a guide dog to the family. Hopefully Lulu would welcome a working dog who is taking good care of me. Dealing with the practicalities of vision loss is not fun, but I try to look at it as an adventure. One I would not have chosen to go on, but one that I will grow from.
Let's just go up here, and then you're going to want to click on
Hopefully
that arrow.
we'll soon be able to fill you in on how the other people from the film are doing. Jessica, Steve, Ray, Pat, Emmett, and Peter. Thanks for watching.